Hello and welcome. Today we'll be discussing a relatively uncommon but important eye condition, Amiodarone-associated optic neuropathy, or AAON. This is a visual problem that can arise in people taking the medication Amiodarone, a drug primarily used to treat irregular heartbeats. We'll explore what causes it, how it affects the eye, how it's diagnosed, and what can be done about it. This information is for educational purposes only and does not substitute professional medical advice. The precise cause of Amiodarone-associated optic neuropathy isn't fully understood, but it is directly linked to the long-term use of amiodarone. Amiodarone is known to accumulate in various tissues of the body due to its fat, soluble nature, and this includes the optic nerve. While the exact mechanism remains under investigation, it's believed that the accumulation of amiodarone and its metabolites directly damages the retinal ganglion cells and their axons, which form the optic nerve. Some researchers hypothesize that it disrupts mitochondrial function within these cells, leading to cellular dysfunction and eventual apoptosis, or cell death. Let's delve a little deeper into the pathophysiology. The optic nerve acts as the crucial pathway that carries visual information from the retina at the back of your eye to the brain. In AAON, the toxic effect of amiodarone disrupts the normal functioning of this nerve. Specifically, it's thought to interfere with the transport of vital molecules along the axons of the optic nerve fibers, a process called axonal transport. This disruption leads to a build-up of proteins and other substances within the nerve, causing swelling and ultimately damage. The damage primarily affects the retinal ganglion cells and their axons, which are essential for transmitting visual signals. As these cells degenerate, vision progressively deteriorates. Amiodarone-associated optic neuropathy is a relatively rare condition, though its exact prevalence is difficult to determine. Estimates suggest that it occurs in a small percentage of patients taking amiodarone, possibly between 1 and 2%. However, the risk increases with higher doses of amiodarone and longer durations of treatment. It's important to note that not everyone taking amiodarone will develop this condition, but patients on the medication, especially those on higher doses for extended periods, should be aware of the potential risk and undergo regular eye exams. The signs and symptoms of AAO can be subtle initially, often developing gradually over weeks or months. The most common symptom is a painless blurring or dimming of vision in both eyes. Patients may also experience difficulty with color perception, particularly with distinguishing shades of blue and yellow. Some individuals may report visual field defects, meaning they have areas of reduced or absent vision in their peripheral field of view. It's crucial to report any changes in vision to your doctor or ophthalmologist promptly, especially if you're taking amiodarone. Diagnosing AAON involves a comprehensive eye examination, including visual acuity testing, color vision testing, and visual field testing. An ophthalmoscope is used to examine the optic nerve at the back of the eye. In AAON, the optic nerve may appear swollen, a condition known as optic disc edema. Additional tests like optical coherence tomography, or OCT, can be used to measure the thickness of the retinal nerve fiber layer, which may be reduced in AAON. Visual evoked potentials, or VIP, can also be used to assess the function of the optic nerve. It's essential to rule out other possible causes of optic neuropathy through blood tests and neuroimaging, like MRI, to confirm the diagnosis. While there aren't distinct classifications or formal types of amiodarone-associated optic neuropathy based on specific characteristics, the severity and progression of the condition can vary. Some patients may experience mild visual changes that stabilize after treatment adjustments, while others may have more significant and irreversible vision loss. The primary treatment for amiodarone-associated optic neuropathy is to discontinue amiodarone, or if medically possible, reduce the dosage. This can be a difficult decision as amiodarone is often essential for managing heart arrhythmias. Close consultation between the patient's cardiologist and ophthalmologist is crucial. Even after stopping amiodarone, it can take months or even years for the drug to be fully eliminated from the body due to its long half-life. While some patients experience improvement in their vision after discontinuation, the degree of recovery varies. There is no proven medication or specific therapy to reverse the damage to the optic nerve. Supportive measures, such as low vision aids, may be helpful for patients with permanent vision loss. Currently, there is no definitive way to completely prevent AAON in patients who require amiodarone. However, several strategies can help minimize the risk. The most important is to use the lowest effective dose of amiodarone necessary to control the heart condition. Regular eye exams, including visual field testing OCT, are essential for early detection of any changes. These exams should be performed before starting amiodarone and then periodically during treatment, typically every 6 to 12 months. Early detection allows for timely intervention, potentially limiting the extent of optic nerve damage. The prognosis for amiodarone-associated optic neuropathy varies depending on the severity of the condition at diagnosis and how quickly amiodarone is discontinued or the dosage reduced. Some patients experience significant improvement in their vision after stopping the medication, while others may have residual visual impairment. In some cases, vision loss can be permanent. Research into AAO is ongoing, focusing on understanding the exact mechanisms of optic nerve damage and developing potential therapies to protect the optic nerve or promote its regeneration. Currently, clinical trials are lacking, but preclinical studies are investigating potential neuroprotective agents. Future research may focus on identifying genetic predispositions that could increase the risk of developing AAO in individuals taking amiodarone.